Carreon's ready to go ahead and review our multi-release.
Thank you, my boss. Yes, just a little bit more. Yeah. Thank you. So, thank you for coming here tonight. I want to say thank you to the San Mateo County Dental Society, okay, to the guys from Jaeger and PSA to organize this. It's a big opportunity to us. The Lighting Instruments is the manufacturer of the laser. This is sponsoring our nice travel to the California. I went yesterday in Los Angeles, giving a training there for a doctor. I will show you a few things that we did there. And today I'm very pleased to be here and share with you, my colleagues, not something that I heard about or something that somebody told me, but the things that I really do in my daily practice using the all-tissue laser. Okay. When I dream about to start to use a laser, it was one thing related a big problem. It was one patient. It's my friend. He did veneers. He lives in another city. He did some veneers with dentists in that city, and he just called me and said, "Oh, I didn't like it, my veneers. I fought with the doctor, and now I wanted you to fix to me." So I'm implantologist, my friend. I'm a perio. I don't work with veneers. No, but I trust on you. Please do it for me. So, and it was a case that those mistakes that we have to think really about before to say yes. Okay, and he came to my practice in São Paulo. It's 200 kilometers of distance of his city, and I had the pleasure to start to use burrs and burrs and burrs over Nimex. And I was very, very surprised because I used a lot of burrs and I can't identify what is the ceramic, what is the cement, and what is the tooth. I started to think that I have to redo my eye surgery because I think I cannot see very well. I think it was my loops is not okay. I tried to the microscope and it was a very, very nightmare. Okay. And I started to look. It was in 2014, what I'm telling you. I started to look about similar to that we have to make misplaced implants removal. It's called a retrieval. It's one thing that you put inside of the implant, take a counter torque, and you can remove the implants. So, and I started to think, I need it for veneers removal. And I started to look what solution we have to veneers removal. And I found that one paper, it was done for one guy from here, is Glenn Van Ness, that he mentioned it. I will show the paper for you. He mentioned that the Herbignac laser can make a very safe and a minimally invasive way veneers removal. And this start, I went in the Cologne in Germany, and I met the guys from the company that I wanted to buy one laser for me. Okay, and this is my story. I started to work with laser for veneers removal, and I discovered during this time working with laser the wonderful laser universe in dental practice. Changed all my life. So if I don't work with this laser, I will not be here. The laser offers to me the doors of the world. I travel around the world. I went in Korea, in Japan, I went in China, in whole Europe, so in Emirates, in whole Latin America, here in US several times that I never wondered that it will be possible, because I was a very unknown dentist in the middle of the 600,000 dentists that we have in Brazil. Brazil, we have 600 dental colleges. We have in Brazil 20% of the all dentists in the world. So it's a lot of dentists. To you be known as a Brazilian dentist is a very tough task, okay? But the laser offers to me the open to me the doors of the world. So what I wanted to share with you is our laser working on aesthetic dentistry, perio and implants, but focused in three very important things: minimally invasive approach, tissue regeneration, and of course, selectivity. This is the beautiful way to work with laser, and this is what I wanted to share with you, okay? I'm a professor of our university in Brazil, is FAIP. Of course, we have a limited time here, but you can see all those things, all those procedures on my Instagram. Is Tony Keep Calm and Carreon 10, okay? Tony Carreon 10. You can check all the videos there. So, many people looks the machine, but pay attention. The machine is just a way to you to achieve the benefits and the advantages of the laser can offer to you, okay? The machine gives to me the opportunity to be focused when I'm working to my patient. Of course, this is a very special patient for you, is my son. When I have to go to the clinic and I say to him, say, Ricardo, let's go to the clinic, I say, okay, daddy, but it's only with laser. Because your patients will only want to be treated by laser. Why? Because the laser will answer all the questions that always have been made by the patients. When will be invented something that don't need needles, has no noise, and no pain? And the big majority of my procedures I do without anesthesia. So I'm a perio and implantologist, okay? So it's a different technology, laser, because my first scanner, it was a Trios 2 monochromatic. For me to be updated with the scanners, I have to buy a new one, I buy a new one, buy a new one. So I'm reinvesting on the laser, on the scanners to be updated, okay? But why is that? Is a problem of the scanners? No, it's the type of technology. Because when we have a new processor that the computer can process better and large information or large images, they offer a new model. If I were of the Sirona family, the same thing. To be updated, I needed to buy a new one. But when you buy a laser, laser works under a physical phenomenon. Is the property of the water absorption of the light. So it's a physical phenomenon. Physical phenomenon never change. Everybody here learn in the early years in the school that the water changes his characteristics if we heat under 100 Celsius degree. Okay, it will change. Is an example of a physical phenomenon. No matter when you learn it, but it's still the same until now. The laser works in the same base because the laser can absorb the water in one ideal point. You cannot change it. If you don't change it, you cannot improve the laser faster or slower, okay? The laser is still working the same. The reason then, you invest one laser and it will be with you for at least 20 years. Mine is still with me, the same machine, never changed for 9 years. Same machine. If you buy the new one now, is the same that I have. This is the beautiful side of the laser technology. You don't need to be updating, buying new ones. It's still with you and offering good things for you every day. So I do a lot of laser explanations in many places. Many people, many doctors hearing my lectures goes to my clinic. So I want to do the surgery with you. And this is the first doctor. Can you just reduce the light a little bit more? Okay? Because I will be more comfortable. Because too many light, I will be shy. Okay? So this is Dr. Paula Bandeira. She's from Salvador, Bahia. Okay? So she just get out of the chair and I here taking up a movie. So I did the full upper jaw, crown laning from the second premolar to the second premolar, gingivectomy with a flapless osteotomy without numb and stimulated the collagenous on her lips. She's ready to do all her own things. If she wants to go to the gym, to eat, to do wherever she wants to do, she is able because the surgery is very comfortable procedure. And after the surgery, she will forget that she did something because laser give to us a, an uncomparable, okay, experience. And only one machine, I can manage whatever I want over the tooth, the soft tissue, the bone, removing ceramics and composites, and biostimulating collagenous on the lips, on the palate for snoring treatment, and facial treatments too. Okay? But Tony, this machine is magic. The machine, you can do a lot of things. Yes, we can, but it's not because of the machine. It's because this wavelength, we can interact with water. And now our body is basically made by water. The reason then we can do a lot of things. It's not because of the machine, but it is because of what the machines interact with. So many people, when I say, oh, we do those things without anesthesia, 99% of you, it's I don't believe it, right? Because I know this is true. Why? Because the people only believes that is true when they buy the machine and when they do the first procedure. The reason then, I want to show to you the first procedure that we did yesterday with the doctor. Doctor, tell me, what are you doing?
I'm doing a crown lengthening procedure, starting off the gingival conditioning gingivectomy.
Tell me, the patient is number.
He is not numb.
And the patient is alive. Who is scared? The doctor or the patient? You saw the eyes of the doctor? He is scared because he's not believing. And now that he is stopped to work, are you feeling like you are doing a surgery? Are you in the middle of the surgery? No, it's okay. So it's possible to you to do another treatment without this laser?
You feel like you can do another? Yeah.
Probably not. Okay, and for you, working as assistant, how it is?
It's very easy. I love it because.
You see the assistant? It's not stressed. It's not nervous. It's relaxed. We have a campaign to reduce the assistant's salary because they do too much less things. Only with the suction there. because there's no bleeding. Just with the suction. Of course, this is the joke, but we improve the whole chain of the procedures.
Tony, thank you so much for coming to my office. I'm very grateful. You came in and gave us such a great lecture and showed us what I thought were some limits, and were able to push us and explain us the laser technology so much more than I thought I would understand in one visit. But all the procedures that we performed yesterday, the crown lengthenings, the lip hydrations, the veneer removal, the crown removals, we did a lot. And I reached out to the patients, and none of them have discomfort, none of them have the pain that I thought they might have. I reached out to our last patient who we did the most amount of work on, and she said that she didn't have to take any pain meds, and she's feeling great. So thank you again for all your help. Thank you, Mike Touch, as well, for introducing me to Dr. Tony. He's a wonderful trainer, and thanks again. Bye-bye.
So yesterday, what is the key? The key is the training. Because if somebody sent to you a machine, you don't know even which button you have to press to turn the machine on. But we take care of the training. We take care of the key of the laser. Because the key of the laser is not use the laser, it's think how to use the laser. Think laser. We needed to think laser. Because when you are think the laser, we are taking the better decisions. Because the laser will help you to do everything. So can you imagine? We gave to him during the morning a very nice lecture, very deep in terms of the science behind the laser. And in the afternoon, we did 4 crown laning. In the afternoon, starts on 2 p.m. until 5 p.m. 4 full arch crown laning, remove 6 veneers, 4 crowns, 2 lips hydration, and 1 desensitizing process. So I work faster with my laser. I work too fast. And are you seeing? Sometimes you are thinking that I accelerated the movie. But it's not. It's in a normal. Because I accelerated my movement. Okay? Because as fast as you move, as fast you remove. Okay? I will make a tattoo here with this sentence. So, why laser? The physicians are still wrong that 30 years they are working with laser and we are not working until now. Light touch is the same type of laser who does the eye surgery. How we numb the eye? A big needle with articaine inside of the eye. How we numb the eye? With drops. Only a topical anesthesia is enough for numbing the eye, that is an organ too much delicate than the mouth tissues. So if to the eye that is too delicate, only the topical is needed, for the mouth, too many procedures, even the topical is needed. Make sense? After this, we make an incision. Oh, we will make a suture. Take a very delicate suture 40, very delicate nylon 40, and make the suture here. Has no suture. Oh, of course not, Tony, because the laser will cauterize. We cannot cauterize the eye, because cauterize means burn. We cannot burn the eye. So if you don't make suture, if you don't make a cauterization process, how heal the incision? It's because this type of laser accelerated by stimulating the healing process. The reason then, I will show to you this post-op that the surgery that we did yesterday, but I'm saving this for the end, just to keep all of you here, okay? So, and the acceptance of the patient is very, very easy to the patient goes to do something with the laser, because they know when it's done by laser is better. And I can charge more. Scientifically, I can charge more. Okay? So, no matter what you are doing, the laser is biostimulating the tissue, is decontaminating the tissue, it's more minimally invasive because when we are cutting the hard tissue, the laser cannot damage the soft tissue. The reason then we can make a sinus lift surgery and it's more comfortable. But if you want to be happy with the laser, you need to combine the light of the machine with the water of the tissue and the movement. The movement is mandatory. As fast as I move, as fast I will remove. Okay? When we say the laser is life, it's not a psychological sentence. It's not something spiritual. It's real because the laser biostimulates. Biostimulators bring the cell to the maximum vital condition. So the reason then you will see, at least on the periodontics procedures, how the laser can heal the gum fast. Okay? But the lasers are not the same. I have a laser here in my hand. It's very good for me to indicate what I wanted to indicate. But does nothing in my mouth. Okay? But it's bad? No, it's pretty good. For me, doing a lecture is perfect. If I take a laser with a few dollars more, I have the light touch. If I press the pedal, we cannot see, indicates anything because it's a infrared. We cannot see the infrared light. Okay? But one is good for one thing and another is good for other thing. But the laser what we are talking about is an erbium. Oh, I was talking with the doctor who wants the wine, and she said to me, I tried an erbium before, but erbium don't mean that they are the same. When we are talking about lasers, we needed to know the name and the surname. This combination means the real laser that are you using, because the erbium YAG is the laser that we are working on, okay? It's the light touch, and the other laser, this is erbium YAG 2, is the photona, okay? They are both equipments has the same wavelength. And why this is important? Because the wavelength will tell you which kind of material the laser will interact, okay? The diodes will interact with hemoglobin and melanin, okay? This is the diode world. But the erbium world is far from here. It's here. The erbium world will interact with hydroxyapatite and water. But you see that when the laser finds the both material together, it prefers to work with water. Okay? So, but what is the main difference between them? So, other laser that is very well known is the CO2. But the CO2, when you go here and you see the CO2, it's like a Solia, okay? They prefer to work with hydroxyapatite because the higher level is hydroxyapatite. The water is lower, okay? But the main difference, at least here in US, is between the erbium and erbichromium. Erbichromium is known like a commercial brand, like a biolaser, okay? Why they are so different? Why people who tried the biolaser, for example, had a not good experience? It's because the machine is bad? No, it's because the wavelength is not the best one, because the top of absorption water of the water laser, this is the name of the equipment of biolaser, it's here. And when you go to the best, the ideal level of water absorption is here. This is erbium YAG. So it's a minimal difference in terms of nanometers, but in terms of water interaction, water absorptions, is too high. Okay? The reason that my friends who has the biolaser calls me, Tony, I tried many times to remove veneers fast as are you doing, and I never could. Because of the machine? No, it's because of the wavelength. It cannot absorb. If I increase the water in the machine, so the laser interacts with the water of the tissue or with the cement, not with the water who come out with of the machine, okay? The reason then you have this big difference is 400% of less absorption in terms of the erbium chromium in comparison with the erbium YAG laser, okay? The reason then all the brands prefer erbium YAG. So if we works with water mainly, okay, we can cut soft tissue because it has a lot of water. The tooth, enamel, dentinal, caries has water and hydroxyapatite. The bone, the same. And we can do the therapy. Why? Because the bacteria body has water. And the laser will, the water inside of the bacteria will absorb the light of the laser and will explode. The reason then, when I set the patient on the chair, the first thing I put in a setting of decontamination, and I decontaminated the mouth of the patient with the laser. It's because we'll kill all the bacteria. Because when I give to him a wash mouth, he is responsible for the decontamination. The patient is responsible. But when I'm using the laser, I'm doing that, and I'm biostimulating, I'm decontaminating, everything at the same time. What I do with the laser? If you give to me today, 9 years after, the scalpel and the cable, I don't know how to assemble the two pieces. Because all my incisions I do with this. It's very accurate, very precise incisions. But more than it, why the patient has swelling after gingival soft tissue management is because many of dentists are using hard instruments to manage. I use the light for release the flap. For example, I release the flap with the light. It's the light cutting. It's not a mechanical movement making a stretch on the tissue. It's very gentle. If you are gentle with somebody, you are give back a kind of gentle attitude. Do it the same with the soft tissue. Okay? Because when you are gentle with the soft tissue will give back a very good post-op without swelling. Okay? Without edema. And you see, I just do 2-3 movements and the flaps, it's opened. Okay? But I'm working a lot, even the compressor is filling. Okay? So, now I will simulate that I'm doing a gingival grafting, okay? Before, I usually remove the grafts and make the peeling to depithelize the tissue outside of the mouth. But sometimes my assistant with the suction drags the graft, and I starts to put a little bit of freight on them. That I said, if you drag the graft, I will take from you to put on the patient. And so they stop it. But now what I do the peeling before to make the grafting removal. Okay. Now I go just to you to see that I can do the peeling to remove depithelize the grafting, to create the vascularization through this grafting. And now we are going to hard tissue. If I work parallel on the root, I will make a bone vaporization. If I work straight to the bone, I will cut as a osteotomy, okay, like a lower jaw bone grafting. But when I'm working on hard tissue, cutting very easily the bone, and when I go to the soft tissue, I cannot hurt the soft tissue. Go, Tony, go there, go, Tony. Yes, you can see. The reason then, when I set the patient, before to wash the mouth of the patient, I pass the laser on the hand of the patient. But not only for kids. but for big ones. Because if don't hurt my hand, will not hurt my tooth. And the patients are relaxed on the chair. And now I'm doing a tooth sectioning. For endo, for a third molar, do you remember the third molar that have the nerve between the roots? That you are only praying for the patient passed away before to him to ask you to remove this tooth? Yes, now you can do it very safe because you have a safe. So how many things I do using only one tool? Can you remember you in your practice doing the same things? How many instruments are you doing? Are you using to do the same? So with the laser is easier. So how easy it is? So we can remove the bone from of the sinus window, preserving the membrane. It's very easy, okay? And you are seeing that the membrane is preserved, okay? So many people also are concerned about laser means temperature. Laser means that we are heating the tissue. This is not related with this kind of laser, okay? Why is that? Because it's the most delicate thing that we can do that we can perform on the patient is a biopsy, okay? When we do with the Herbuniag, is the same when we do with the scalpel. But when we do with the scalpel, we are only cutting. When we are doing with the Herbuniag, we are cutting, decontaminating, biostimulating. So the post-op of the patient is nice, but when we perform with the diodes, we burn the peripheral zone. But the Herbuniag laser, it's not burning because has less negative thermal effect on the soft tissue. So this laser never hits. Mike, if they ask for those articles, I can send to you a link and you can distribute to them, okay? So let's talk about the minimally invasive concept. What is this? It's to be most conservative in our approach as much as possible. So only the Herbuniag laser can ablate the caries, keeping the integrity of the tissue because the laser knows what is the enamel, what is the healthy dentinal tissue, and what is the caries. Okay, this is a uh, how do you say this? Breaking news made in 2009. It's not new. It has a very, very large scientific papers done about it. Okay. Other breaking news: the use of Herbuniag laser for caries removal in pediatric patients, following the minimally invasive concepts, following the yellow lines. Okay. So the laser will only remove the small area, only the infected area. Okay, will use the antibacterial property to decontaminate the dentinal tissue, and also will biostimulate the remineralizing properties. And when I do the cavitation with the laser, affects or not affect the adhesion process? Affect. But it's even better because we will assure a better retention of the composite of the composite cement when we are doing crowns and veneers. And when I'm doing the cavitation in the cavity setting and I pass this light in the enamel border, what I'm doing, I'm preparing the enamel surface with the laser before the etching. And if I do this, it will give to me a better marginal sealment of this restoration or my veneer. The people always say, Tony, I want the laser for veneers removal. I use it much more for placing veneers than for veneers removal because I don't remove veneers every day, but we place veneers every day. And I don't place any veneers without prep the surface, without desensitizing before, because I don't want my patients with sensitivity after cementation. And the laser is responsible for that, okay? What more we can do? How is this laser conditioning, laser etching, okay? So this is the enamel. It was irradiated with the laser, has the same morphology of the etching as the etching, and the dentinal tissue, it will be with the dentinal tubules opened without a smear layer and with exposure of tags of collagen. It's the ideal surface for adhesion. And it will show, it will be very, very clear when we see this paper. There is a comparison when we do laser and the conventional method for adhesion process. If I use diamond bore and the etching process is the conventional method, for me to deattach this ceramic from the tooth, I need 6.84 megapascal of power to deattach this. If I only use a light touch, it's the same. I don't need to do the etching, okay? But I use, because when I use, as the paper tells me, of course, this is not a commercial lecture, but I want to offer to them a promotion, okay? All you who buys the Ebriniag laser will win immediately 30% more adhesion. It's better than money, because it's your patient not appearing, oh, my bridge falls, okay? And this is the laser. But let's assume that we are talking about erbium and the difference into Ebriniag and ebruchromium. If you use the ebruchromium like biolace, it's even less than the normal. And if you use the ebruchromium plus the etching, it's even less adhesion. The reason then we needed to know which kind of laser we are using for, because the name and the surname means a lot, not in terms of brand, but in terms of science, in terms of results, in terms of speed of work. And how the laser is selective, because the laser interacts with water. So in the enamel we have a 2-4%, the healthy dentinal tissue 12, and in the cavities we have 24% of water. Wow, much more water here. It's like you with your car downhill. So you need to press the pedal of the accelerator or your car go by itself, okay? But when your car goes to the plain terrain, the car starts to go, okay? Decrease, yes? So, because the energy of the laser is needed to make the caries removal, it's less than the dentinal tissue because it has less water. So if it has less water, I needed to increase the power. So if I use the deep cavities setting for this removal, I can do it with my eyes closed. Because when I arrive over the healthy dentinal tissue, the laser cannot remove. So the selectivity is made by the laser and not by my eyes. The laser knows what is one tissue and another. And when I increase the power and go in a plain terrain, when I needed to go up, I needed to increase the power of my car. It's the same. When I arrived over the enamel, for me to cut the enamel, I needed to put in the enamel setting who indicates 300 millijoules. And with this power, I can make an endodontic access or a tooth sectioning. But let's see this working. First of all, we will start to work flying. We are not, you will hear more the suction than the laser, okay? But you don't see the material coming out, you only see the hole being done, okay? And when we arrive on the healthy dentinal tissue, even if I stay passing the laser, but with the caries removal setting, if I touch the enamel, will conditioning the enamel for me. And when I arrives on the healthy dentinal tissue, even if I insist to pass the laser cannot remove it. Okay? So, but, and you ask for me, what about the wall? How I can clean the wall? So we are working with light. We have a one tip that the light comes and goes out 90 degrees. And I can work like a submarine periscope, doing this movement with my handpiece. And I can clean the wall without to open my access. Okay? So the caries removal setting cannot remove the dentinal. It's not power enough for doing that. But this power is enough to do one thing that's very, very important. It's decontaminating the 1 millimeter in a depth of 1 millimeter after the laser irradiation. How we know that? We know about because of the papers. And this paper will tell us that the laser can decontaminate 1 millimeter after the laser irradiation. This good disinfection of the contaminated dentin will prevent of failure of the restorative process caused by secondary caries, because we are not using a mechanical tool for killing a biological disease. We are using a biological weapon to kill a biological bacteria, because the laser knows how the bacteria, where is the bacteria, okay, and interacts with the body of the bacteria, killing everything. Tony, it's difficult to use the laser. Remember, move fast, remove fast, okay? This is one guy using the laser for the first time. I just apologize because I'm trying to take the movie, but I have to pay attention on him. I have to pay attention on the movie, and you will see a kind of balance. But what I want to show to you is not a prepared movie. This is natural. It's what happened during your training with us in your clinic. Okay? So, what I'm saying to him, fast, 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 move fast, move fast, move fast. And you will see in 30 seconds, the patient also is not, we do not numb the patient. Okay? And what happened if he goes to the nick tone? What is happening? Nothing, because the laser will think it is soft tissue. Okay? But it's okay. Now it's finished, and I say to him, oh, it's finished. And he said to me, but I waited 20 days to have my machine. I want to keep working. So you can stay for all day there. Why? Because the composite setting is the same of caries setting. So we are using the same. So the laser will remove the composite and the caries under the composite, preserving the enamel and the healthy dentinal tissue. Okay? And conditioning. So I took a picture before, draw wall, just for you to see the limits, a border, the limits of the composite. And he doing those crazy movements. What he did is only making the composite and the caries removal. But what about it? If the laser didn't remove it, what I will keep here, because the laser will penetrate 1 millimeter and will decontaminate this affected area. Okay, and I'm ready to do a new restoration. Like this, how deep I can go without anesthesia. Okay, this is the same guy in the following day doing by himself this restoration, and he sent to me, I'm sorry, it's in Portuguese, but this caries removal extremely deep without anesthesia, only with laser, look at the pulp. Because if everything is caries, of course we will have pulp exposure. What I do, I will send for the, where is the endodontist? He's in the last line. Hi. You know how to do other things, or you only use, you do endo? Yeah, oh, okay, great. Because, we are doing with the laser a pulp capping here. The laser will decontaminate and biostimulate it. We make a pulp capping process of restoration and composite. And we have a 15 months and 30 months without sensitivity and without a root canal treatment. Okay? But it's amazing for end, okay? It's just a joke, okay? So, let's talk about veneers removal because it's a big trend, okay? Why this picture is important for me? Because the only thing who I want is the cement. The ceramic has no water, okay? If the ceramic has no water, the laser doesn't know that the ceramic is there. For the laser, the ceramic is a transparent glass. Okay, I'm a dentist with problems with the compressor noise. So, but let's talk about the bonding, okay? Let's understand how this process happened. This is the paper that I told you that changed my life. Thank you very much. So, when we are talking about, as I was looking for a solution, okay, I, I read this title and say, using the erbium laser to remove porcelain veneers in 60 seconds. After my first experience, remove with the burr. So it was so worst situation. I said, or this guy is a big liar, or he has the magic that I need. And I was looking for the magic, okay? And what he's saying, that for more than 30 years, the veneers serve to us clinicians like a quick smile transformation, okay? You place veneers from the canine to canine, is another person. But the time by time, those veneers needs to be replaced. He puts 4 reasons for that. Caries, fractures, infiltration, or the patient didn't like it, the outcome. Okay? After that, I take another reasons for that, and I will explain. So, and the laser can be used for this in a minimally invasive way, safe, okay, and efficient. Wow, nice. But in a predictable way to remove all 3 letters, all porcelain restorations. So he's mentioning the title veneers, but all porcelain restorations opened my mind. So veneers, crowns, onlays, inlays, and ceramic fragments. I can remove all. And in an economic country like Brazil, also keep it then in one piece. Wow! I can remove and I can clean and I can re-cement the same. Because once I was placing veneers in the father of the bride, I think is a important person for the pictures album for the bride, and 9 p.m. in a Friday, and the wedding it's the next day at 9 a.m. So no mistakes are available. And when I were placing the veneer, I touch with my light cure and the veneer a little bit out of position, mispositioned. I cry? No, I took my laser, remove the veneer, clean, and re-cement. I don't want to wish the same situation for anybody of you, okay? The reason then think, if you are in the same situation, placing the veneer and you place mispositioned, what do? You will cry because 9 p.m. on Friday, my technician is not available. Even for me to pay him, he doesn't want to talk to me on a Friday. Okay? No, talk to me tomorrow. Okay? So I have a very good opportunity to solve problems. That doesn't happen with you, but happens with me. Other time, I pick the wrong cement color. And all the outcome, it was totally different than the patient expectation. What I did, I removed all the pieces, clean, changed the color of the cement, and re-cement. Nice, no? 5 minutes. Another thing is when the patient doesn't like the color of the ceramic. He asked me for a white toilet from the IKEA color of the ceramics. And okay, I wanted something more natural. Okay, I took all it off, sent to my technician, and my technician changed the color, and the re-cement the same. Okay, but all those things are important as we understand the main reason for doing that, as because we are not touching the remaining tissue again with the burr. We are not losing biological tissue cutting ceramics. This is the main importance. But the Glenn Van As didn't ask it how to remove. He didn't ask it. He asked it how the adhesion happens. It's because the cement suffer a light reaction. But which kind of light? Oh, the violet light. Okay? If I have a poison making a photo activation in one side, the antidote, it's in another side. So we are using the erbium to degrade the hydroxyls, is water molecules inside of the cement that will do a photo deactivation, degrading the cement and just removing the adhesion of the laminates. Okay? So, if my patient wants something more natural or something more artificial, it's his call. If next World Cup he wants, it will be here, one blue, one white, one red, one blue, one white. This is his call. But I never touch again the remaining tissue. This is the main reason that we are working. But the importance that I saw during those days making veneers removal all around the world is the people are missing the opportunity to give back the biological space. They cut or with soft tissue laser, or they cut with electrical surgery, or they do with scalpel, but they don't pay attention in the biological space between the new gingival level with the bone crystal. And we have to respect those 3 millimeters because this is the same patient. We remove all, I go under with the laser and cut only the bone. You can see the health of the gingiva immediately. But this is the main reason. This is one fractured veneer that I want to show to you. What is the enamel, what is the cement, and the veneer. And the light cross the veneer and will interact with the underlayer of the cement. Nothing happened inside of the ceramic because the ceramic has no water. So the laser doesn't know. What is the reality? This is our veneers course in Brazil, okay? This is a dentist, my victim. It's Carlos Herton. Is the best dental photography professor. So first of thing, I will just clean his mouth. I washing his mouth, okay? Just decontaminating. It's not removing anything. It's not cutting anything, okay? All the students are around. You see, I'm using glasses, property goggles for the laser, but they are transparent because this laser is very friendly. Now I will start to do the removal. You see, I'm moving fast. I'm moving fast. Now it's bigger to you to see. and I'm explaining to the students how is the process. Now, 1, 2, 3, done. So is everybody around filming? Okay, and after, he will stay for 3 days. Okay, I have a colleague who does the restoration process. He does how to make preps, how to make the veneers, how to make up veneers. So he works 2 days. I work only 20 minutes, but it's 50-50 course. I I don't care if he doesn't use the laser. Okay, the laser is my part. Okay, so but this affects even this. Okay, so now I will perform the desensitizing because he will stay 3 days with mock-up. Okay, I pass the air, 0 to 10 of level of pain, 12. Okay, and now I will desensitize him. So you are placing provisional in your patients. Desensitize. Your patient don't want to pay for bleaching. Desensitize. I don't lose patients because of bleaching, because I desensitize. This is 1 minute process. Use the air again. Nothing. 0. Okay. So this is a training. I remove all those pieces. Now the doctor will make the first removal. Fast, 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 fast. You see, is the first. Some that we placed that we wanted to change the color. Go to my technician. He changed the color and the shape of the pieces, and we replace again. Okay, I can do it. Of course, I can do it. Why? Because I invented? No, because the papers allow us to re-cement, reuse the veneers who were cemented in the misposition or miscolor. Zirconium crown. Same patient that you saw the doctors laughing, okay? So now you see the light crossing the inside of the piece. This flashes is not outside, it's inside, okay? Not numb the patient, okay? This is a zirconium crown. Move fast with the right wavelength, everything will happen. Who is doing that? I am doing that to show to him how to do it. So it's all in the papers, okay? So composite veneers, oh, it's less invasive. For me, after the laser, the invasibility or the invasive way is made by the burn and not because of the restoration material. If it's ceramic or if it's composite, no matter. But I can also, if you remember the class 1 that the guy will make the removal, the laser will remove the composite without to touch the enamel or the health dentinal tissue. Okay? And we are vaporizing the composite. Why the composite don't deattach like the ceramic? Because the ceramic has the ceramic and the cement. The laser works on the cement and the water of the cement. Here, the water is inside of whole body of the composite. So we needed to vaporize it, but we vaporize only the composite, okay? This paper we did this making composite veneer removal with burr magnification, with blue light and everything, and all the red is a health tissue. It was removed without needed. And here is done with the laser. So you can see how the laser can protect the remaining tissue. So for me, if the patient has a problem with one veneers, is a McLaren pit stop. Okay, so he comes. I only want to use. I only want. I only will remove one veneer. So I clean the mouth of the patient, put metal brands to not affect the neighbors, cementation. After 18 seconds, drops. I will clean, I will desensitize with the laser, and I will recement the same ceramic in 5 minutes. If if my, I don't know here, but in Brazil, the patients fracture their ceramics eating bread. I don't know what's it is, if it's onion or something more hard, okay? But if my patient fracture one ceramic, okay, he just sent me a picture. If I see it's only the ceramic which was affected, I call to my technician, say, mill the central of John. When John arrives, I have the new piece. I just decement one and recement another one. In 5 minutes is done. So it's good for who? For the patient, nice. But for me, it's even better because I can solve problems quickly. And this is very important for my position as a dentist in the market. Okay? It's my position in the market because when the problems happen, is the way that you can differentiate you from the others in solving problems. Okay, this is very, very important. And after that, I remove all the pieces. Okay, what I'm doing, I'm prepping the surface before the cementation. At the same time, I'm decontaminating, I'm desensitizing, and also I'm conditioning those surface. And how it will appears? Will appears whiter is the enamel, and when you have a more orange is the dentinal tissue. Metal ceramic brackets. The patients love, the dentist hates. Only 3 seconds is needed. Okay? Why I hold? Because I sometimes my orthodontist want to change the position. Okay? I hold it so the patient don't swallow it. Oh, I can do it. Yes, I can do it. The paper says that we can do it. But the most important thing, as the temperature inside of the tooth did not increase and also decrease it when I use the laser. So if I have somebody who has concerned about temperature, ta-da, okay? Now we are the time in the aligners. I can tell you, it's terrible, those aligners, but I'm using, okay. But it will be a time that I need to remove my attachments. And I use the laser because I don't want to make any aggression on my enamel surface. The reason then I prefer the laser than the mechanical burrs. Let's talk about surgeries. So this is another dentist. She's Venezuelan, okay? And she asked me, Antonio, I want a veneer. So you are too young. Let's make first your gingiva, and after, let's reorganize your gingiva, and after we can think about the veneers. Okay, she agreed. It was done during a course that I went in Caracas, okay? So here is the lateral. You saw, this is the tooth that I took a lot of gingiva, only one cord of bleeding. Just it. This laser cauterized, no, bleeds less, just for a while. 2 minutes after the surgery, no bleeding more. Okay? So I will explain how the surgery proceeds, but I did in one day. I did only the gingivectomy, and I asked to her, "May I do the osteotomy only tomorrow?" And she said, why? It's because I want to take a picture. It's a scientific, because she's in a course. And so she said, okay, what's happening if I only perform the gingiva without taking care of the bone? Next day, all the gingiva grows 1 millimeter. And if you use your electrosurgery, not you, but if some dentists use the electrosurgery and place the veneer, what happens with this gingiva? It starts to roll up over the ceramic, and you have a, a biological space problems. Okay, I performed again, removed this gingiva, removed all the bone. She sent me, I'm sorry, a mobile phone picture after 4 days. You can say that this patient, it was done a surgery 4 days before. This is the power of the laser. It's only, it's increased the beauty of the surgery day by day. Okay, the laser always improves. And 1 week, 4 days after, this is the result. She needs veneers. It's a crime to place veneers on this girl. 24 years. Okay? And after a year, she didn't place veneers. She didn't make bleaching. She didn't use the floss. She didn't make prophylaxis. Nothing. She's very happy. So how we do the surgery? First of all, okay, I teach how to make a plan because many doctors try to skip the surgeries, okay? And I teach them how to do it easily. Why I'm marking using a sharp? Because I'm not numbing the patient. If I use my instrument, it will hurt. I don't want to hurt the patient, okay? And I come from the bottom to the top, erasing. It's like I'm using an eraser, like I'm just erasing the excess of the gingiva. I come from the bottom to the top, and I can draw. I'm drawing the new shape of the gingiva. It's very, very easy. Why I can say that? Because even me can perform nice surgeries with the laser. It's very, very easy. So you enjoy a lot. Let's call the ambulance because it's bleeding a lot. Emergency. No, it's nice. And the most important thing, the end of the surgery, this is the aspect of the surgery. Looks like she did a surgery. So we use a thermographic camera just to show that in the area that we are doing surgery is blue or yellow or green, is this part of less temperature than the normal body temperature. Always we are without the temperature, okay? This case it was very, very nice. I do my planning, okay? I pick the thickness of the tip in according of the gingival phenotype. And here I'm working through the microscope. I did this case in Medellin in Colombia, okay? I'm performing the surgery. I'm seeing bleeding more, but the patient is still not with no anesthesia. Even the flavor of the bleeding, the patient cannot perceive because the laser make everything neutral, okay? So it's very, very nice. Now I'm performing the osteotomy. So this is a mark that I do with 3 millimeters, okay? When I cut hard tissue, I cannot cut the soft tissue, okay? So I go inside of the sulcus. Now I'm probing, only probing, where is the bone, where is the bone, where is the bone, where is the bone. I use a soft bone program, and I start. Goes back, probe, done, 3 millimeters. In 4 seconds, I do it. The reason then, a full arch, we can do in 10 minutes. And this bleeding, in 2 minutes after the surgery, is completely stopped. Okay? The patient paid only half of the surgery. We did half of the surgery. You don't do it here? Oh, you have to learn a lot with us Brazilians. So, one thing is very important. In the same time that we are performing the surgery, we are treating the gingiva. Okay, we are treating the pocket, we are treating everything. Okay, so what I like it 3 days after the outcome of the surgery. Just for explain, I did in the afternoon, in the end of the afternoon, the half of the surgery. We were in a hotel like here, did a lecture. When I arrived this part, go back to the clinic, is beside of the hotel, and we did a live surgery for the whole audience. Mike, organize for the next time to us to do the same for our colleagues here, okay? So, but I love 3 days after. Why is that? Because the laser is a daily improvement of the outcome. 3 days after, you cannot say that the surgery was done here, okay? So, this is a model, a Brazilian model, okay? Thousands and thousands and thousands of pictures, no smiling. Why is that? Because her gingiva is not well organized. Give me 10 minutes. She has 26. 26 without smiling. For her to give me this smiling is because I performed the hair surgery for free during a course. Only with this, I could, she gave me a surgery. So after 10 minutes, she made her first smiling picture. 3 days after she's speaking, of course, she's speaking in Portuguese, but she's saying, oh, Tony's so beautiful, she's nice, I love him. Oh, this is a problem that she's already married, but this is what she's saying. Of course not. But she's saying that the surgery was nice. And now, when she wants to smile, she smiles. When the picture needs that she smiles, she smiles. But I didn't anything, no composite, nothing, only well organizing well the gingiva. The reason then I call this protocol the gingival changes, because changes more than the mouth, changes the psychological side of the patient. Because a girl, beautiful girl, who never smiles. So the melanin on the gum, it's like to do a peeling, gingival peeling. Okay, it's very, very easy to be performed. Okay, we vaporize until to arrive, and this is one day, this is the next day. It's 24 hours before and after. Okay, it's easy, it's painless, it's very easy to do it. Okay, many people say, oh, I want to buy equipment of prophylaxis. I have the best one. Why? Because I can remove the calculus, I can treat the gum, I can decontaminate, and I can also desensitize it. It's very easy, it's selective, okay? And once again, it's only one equipment. So the reason then I have a very nice friend in New York is Jeff Shapiro. She bought 3 light touch in the same day. And now he said to me, Tony, it was the best situation because I can offer laser for all my patients. For all my patients. And why do the Perio with the laser? Because I can do everything and have a better situation. So, Tony, but I using the curette, the hand curette. Okay, this is the result after the use of sharp mechanical instrument on the soft tissue. This is the laser. So the integrity of the tissue is evident. The reason then we use a laser for eye surgery. Can you imagine if we use hand curettes in the eye? Everybody's blind. Blind land. Okay, not more earth, blind land. The reason then we prefer the eye. So this is a doctor. She's a PhD in nutrition. But you can see how much, and she said to me, Tony, my problem is not money. My problem is not because I'm lazy to to take care of my hygiene is because she creates a lot of calculus in days, and she suffered a lot. Even after you numb her, in the next following days is a nightmare for her too because of that. So you can see the color. This is the immediate picture after laser calculus removal. You can see how pinky is healthy. She just used a lipstick to take a new picture because we changed the behavior of the patient. We changed the mentality. She felt that she's beautiful because now she's clean. Okay? And how is the root surface when we take care of the laser? Is decontaminated, no smear layer, micro roughness, high density of collagenous fibers, and the cement matrix is preserved. The reason then the laser is an alternative non-surgical for the periodontal treatment of the most common periodontal disease, to the moderate and chronics. Okay? And if it's one field that have to work very, very efficient, is the perio. You know why? Because my wife is a periodontist. If it doesn't work, she kills me. Okay? But we go from here to here easily. We are saving the tooths. We are saving a lot of money from the patients because this is the best alternative for an implant, for the pocket of the patient. So you are investing, and I charge more, but I tell to my patients that I'm offering a better solution. Okay, my implant surgeries. You can see that I'm making an incision. I'm releasing the flap, doing the syndesmotomy. I'm organizing the bone, making a whole curettage, and now this is my pilot drill. I'm using to cut the cortical bone, and after I'm performing with the normal burrs. Like this, I make the hole, performing the hole in depth, using only the taper, comes back to the laser to remove all those debris, bone debris, and place a ceramic implant here. Okay? So you can see it's bleeding a lot. Are you fighting with your assistant? No, it's not stressful. The only concern of my assistant is because I like to sing during the surgeries, and I sing very, very badly. But I clean the hole because those debris, it's delay the osseointegration process, and I offering all the implant bed without debris, and all the papers we give to us. That is the importance that I can give an early functional loading, not a early loading, early functional loading to my patients. So I don't need you to place a crown, relieve a crown for a while, and after to place the final crown. Okay? For sinus, you saw in the egg. This doctor that I'm teaching, she has 62 years old. It's her first patient with the light touch. What is she doing? It's a sinus lift. She's very brave. But because the laser makes you feel safer, because you know that you cannot make any problem, okay? And are you cutting very, very fast? For periimplantitis, so periimplantitis is the problem. The solution is make the bone growth over the implant again. So you can do without flap or flapless or opening the flap. Sometimes I prefer to open the flap. Clean the implant only using laser. biostimulated the bone with the laser. I created micro holes here. Coconut glue, white glue. Why coconut? It's not coconut. It's because you can place your grafting material that you like, okay? Because the laser is giving to you a sterilized implant surface and a biostimulated bone surface, bone marginal surface. And 9 months after. One thing is pretty good. The clinical cases that we have in our practice is the same that the papers. It's very, very predictable. Work with laser is predictability. Okay? Okay? So, my friend Endo, oh, do you want to take a coffee outside of the room? No? We'll just chat on that. Okay. So, now we are very confident on tissue regeneration, okay? So, what we do, it's endo, treat the endo, and we had a kind of a fistula. I go inside of the fistula with the laser, decontaminate, biostimulate, and 3 months after, we healed without to retreat. So this is my first approach now, is doing that. Okay? If it works, okay, we will relieve here. But if it doesn't work, you have to retreat the root canal. But my first option that I can do in 30 seconds. The reason that I work faster. But we are being more and more confident on that. This patient appears in my clinic. I wanted to make some organize my mouth. Okay, let's make a CTBC. We did a CTBC. What happened here? Oh, I don't know. You don't know. The doctor did a apsectomy on you. You didn't? No, I don't remember. So it was performed 3 months before. In January 2023, he appears. And what I did, I insert the tip here, I create a fistula, go inside, and just clean and biostimulate it. 30 days after, I have the neocytus here. It's not bone, it's just a signalization, but I didn't graft, okay? It's only the laser and the coagulus here. And I have a signalization of the bone will be created here, okay? What I did, I waited for 1.5 years and 2 years and 2 months to have it, okay? So this is the power of the bone for regenerated tissue. And we have the papers to show that the laser irradiation for the osteoblasts-like cells is effectivity for activation bone of the metabolism factors. So we have to think laser. The reason that, we use the laser, nice. You think laser better, because the laser for me is not a side character of my movie. No, he's the principal of my movie. He's the main actor of my movie, okay? And we have a different lasers. I work with 2 lasers. Those 2 lasers that's available for you to see. That one laser, this is the diode. I perform surgeries with the diode. This also without anesthesia. When I have brackets on the mouth, because with the Erbium I go from the bottom to the upper. But in the same patient, I did the gingivectomy just to remove the excess of the gingiva caused by the ortho movements, okay? And after I simulate collagenous for her, she's graduated in dentistry, I give new lips for the album. But I use the diode previously when I'm numbing the patient, okay? Because sometimes we need to numb the patient. I'm doing a sinus lift, I have to numb. For frenectomies, I like to numb patients for frenectomies. I use the laser to make better than the topical anesthesia. The laser can perform a light anesthesia. It's very, very nice. And we perform the punction here with the needle, and the patient will not feel anything with the needle. This is much, much better with the topical, because the topical is very, very superficial. when you use the light, the 980 nanometers is very deep. It goes deep. And when we make the punction with the needle, we go deep. The topical cannot go deep like this. And after I performed I cut the frenulum with the erbium because I prefer to make surgeries with the erbium. And after I comes back with my diode to perform. Here I do cauterization, and the diode can do it. Okay, the reason then I can work uh, balancing one and other. It's not because one is better than the other. It's because one is indicated better in the every case. And this is the end of the surgery. Okay, no suture. I don't suture. Okay, it's this. Okay, to improve the lips, it's a accelerated move because one session is 4 minutes. And I have not more 4 minutes to you. I have to finish. Okay, Mike? My boss. Okay, you can see. And I give this for my patients when I perform surgeries. Okay, and I use this as a treatment when the climate changes. Okay, when it's cold to hot, sometimes the lips is fissures, and I do this as a treatment for fissures in the lips, on the lips. Okay, so if we biostimulate on the lips, let's biostimulate on the palate. Okay, and we biostimulate the palate becomes rigid. If it's rigid, has no vibration, and the snoring is a vibration of the soft palate. Okay, so we go. You have to hear this. It's a big pleasure. This is before the session. We take a measurement, and after. I charge at least 1,500 per treatment. It's only 3 sessions, okay, for 15 minutes. And I use the lower jaw advanced appliance too, because one thing is treating the snoring. This is the make the shrinkage of the soft palate. Another thing is the apnea, is to advance the mandibular, because the lower jaw, because when you sleep, your tongue goes and block the oropharynx. Okay, a lot of papers talking about this. This is becoming a new trend around the world, and you see more than veneers removal is snoring treatment. My last case, I want to show to you when the dentist really matters. I went to the clinic to train one doctor for veneers removal, and it's a big clinic. They have a maxillofacial surgeon inside of the building, inside of the clinic, and they are talking about this case. Is large cells cyst. Okay, it's a benign, but it was taking a lot of tissue, and they were preparing for remove all those tooth and place implants in the bone that they have. Okay, and I told them, so why we don't do the surgery on him today? And they said, why? This is the conventional planning. It says, I know, but when you have a laser, you are not more conventional. We are laser. We have to think laser. So why a guy with 45 years will lose all this half of a lower arch? I will give this opportunity. No, I will take the opportunity to use the laser. So let's see the case. Has an exposure, and I use what? Incision with the laser, release the flap with the laser, anesthesia, of course, and I'm just cleaning the bone. I'm cleaning, removing the granulated tissue, vaporizing the granulated tissue, because the healing process, the bone will grow from the bone, and I have to clean. And I was cleaning. I only used this instrument during the whole surgery. It was accurate to remove all the granulated tissue that we vaporized. Okay, I used my 90 angle degrees tip to clean and to give me more access. And after I performed my bone stimulated. So I press the pedal for 3 seconds, create a micro hole, and inside of this micro hole, the bleeding comes. The bleeding comes bringing the bone growth factors. Okay. This is the maxillofacial. He's seated. You see the risk that I suffer? This is the guy who bought the machine, his own foot. This is the face of the patient after the surgery. How long it was the surgery? 24 minutes. I have the whole surgery grabbed. Okay? This is the day of the surgery. We did the endo. We did the endo. We did the endo in the next day because the endodontist was not available. The correct way is to perform the endo before the surgery, but the situation didn't allow it. But this endo, it was done immediate, but this is 1 year after. Ah, nice. That's nice. But still without a differentiation of the bone. Remember, the grafting was done here 2 years and 4 years. But you can see this shield of the cortical bone in the lower jaw is the type 1 bone, is the most difficult bone to be growth. And we have a very nice one. This is the power of the laser. This is what I want to share with you. Think laser. And this guy will die with his own tooth, with his own teeth, okay? Without an implant, without a dental implant prosthodontic solution. It's his own tooth, it's his own tissue, and only the laser allow us to do it, okay? This is the case that we did yesterday. In 10 minutes, what we offer for this blonde, beautiful girl. This is in the middle of the surgery. Oh, it's bleeding. This is the end of the surgery. This is today, her picture today that he took from her own phone. Only here you can see, but tomorrow, I guarantee that she will have nothing. And I tried to grab a video of her. You can see how beautiful she is. Your surgery. Tell us before. What about your smile? What is your life? Tell us.
I wouldn't smile. I mean, I'm not a really smiley person and with a really smiley personality. And I just.
And he could make it. So, this is the beautiful perception that I have every day with the laser. In 10 minutes, you can change totally the life of one person using the most innovative technology, who will offer to you the opportunity to work faster, to charge more, and to have a lot of emotional testimonials like we always have. This is one person who works in the front desk of the most beautiful clinic in Russia, in Moscow. I went there in November, last November, and I say, give me 10 minutes. And in 10 minutes, I will offer to you a beautiful smile without anesthesia, to you to not be afraid of a dentist again, and This is my life with laser. For me, laser is life and light to bring to us a better dentistry in our practice. Thank you very much. This is my dentist and my beautiful family. Thank you very much. I appreciate a lot. Mike, I spoke a lot from Tony Carreon to Tony Carreoff. Now is with you.